For poor women in Bangladesh, having a baby is dangerous, though things are improving. Every year, thousands of mothers die from avoidable causes. Many are practically children themselves, pregnant before their bodies are ready to bear a child. 2/3 of Bangladeshi girls marry before age 18. 3 out of 4 women still give birth at home with no one who can assist if things go wrong. The government, with international support, is working to change this tragic situation. A United Nations interagency project is helping to improve all levels of maternal and newborn health care. With better trained staff and improved facilities, more women can now get free prenatal care and skilled delivery assistance close to where they live. Community health volunteers encourage women to use the services and to practice family planning. They also lead discussions on how to stay healthy during pregnancy and potential danger signs. I've learned that I should take rest during the day, get lots of sleep at night, and eat more than usual. Getting enough to eat is a challenge for many of the pregnant women who come to the community clinic run by Roshana Begum. Out of every 10 pregnant women I examine, only 2 or 3 are healthy. Most are malnourished and anemic. Beauty, 4 months pregnant at 16, is not well. Her mother brings her to the village clinic, severely weakened by anemia, jaundice, and an infection. Alarmed by her condition, Roshana tells Beauty's mother to take her daughter right away to the health center in town. Sadly, Beauty doesn't have a say in whether to follow Roshana's instructions. 2 days after visiting the clinic, Beauty's family has still not taken her to the doctor in town. Instead, they are treating her with herbal remedies. Another family has ignored urgent instructions, putting an 18-year-old's life in peril. Family welfare visitor Kanchan Roy was very concerned. The patient was suffering from labor pains for many hours and there was no progress. I told her relatives that this could seriously harm mother and baby. She has to deliver in the hospital, not at home or in the clinic. Despite Taslima's condition, her father-in-law decided to take her back home rather than pay for a longer taxi ride to the district hospital. Only after Kanchan and a medical officer came to their home did the family agree to take Taslima to the hospital. Fortunately, it was not too late. After emergency surgery, mother and baby would be okay. The hospital in Malvi Bazar was ready for them. Since the UN provided new equipment and helped train additional personnel, the number of life-saving surgical deliveries has doubled. The assistance is part of a joint project of the World Health Organization, UNICEF, and UNFPA, the United Nations Population Fund, supported by the United Kingdom, the European Union, and Canada. There is now staffing around the clock to handle emergency cases like Taslima's, and more capacity to treat patients like Beauty. Her family, too, finally agreed to take her to the district hospital. She had to wait briefly for a bed, but soon started treatment and went home 6 days later in a much better condition. To further reduce maternal deaths and disability, Bangladesh is creating a cadre of full-time midwives, meeting international midwifery standards. Once trained, they know how to manage difficult deliveries on their own and how to provide holistic care, monitoring patients throughout their pregnancies. When someone comes for a prenatal exam, I give her advice about pregnancy and childbirth and counsel her to give birth in the hospital. When the time comes, I will conduct the delivery myself. The government has pledged to deploy 3,000 midwives by 2015. Hundreds of nurses are now in training to upgrade their knowledge, and a direct entry midwifery program will start soon. UNFPA is supporting the effort. Dr. Babatunde Osotimehin is UNFPA's executive director.
We know that the best intervention and the most important intervention in reducing maternal mortality is having a skilled birth attendant during the process of labor and childbearing. Now, what Bangladesh is doing is to position trained birth attendants to attend to women who not only at birth but during pregnancy. so that they can provide them with the education they need, with antenatal care, and with assistance during labor and childbirth. And I think that will make a lot of difference.
To save more mothers' lives, Bangladesh also needs to make communities understand the importance of using the services now available. This calls for more grassroots-level health educators, like the neighbor who got Dipali to go for her first checkup. She went through 3 previous pregnancies without seeing a health worker and gave birth at home even though a clinic was nearby. The last delivery was quite painful. This time, Dipali plans to deliver with Kanchan's help. I want to have this baby here at the clinic. It was community health volunteer Sriti Malakar who persuaded Dipali to come for her exam. Sriti got her job after finishing high school, a first in her poor community. When I heard she was pregnant, I went to her house. I said to the family, if she goes for prenatal care, she will know the baby's position and learn what to eat to stay healthy. After 4 visits, they agreed. With better services that can safeguard the lives of mothers and newborns, and more outreach to communities to use them, Bangladesh intends to take the danger out of childbirth.
So why not go to the health center instead of calling?